Acupuncture used in a prestigious medical university hospital? For real? For those skeptics who don't believe in acupuncture and treat it as a witchcraft or voodoo medicine. Here are some insights from a Stanford University MD anesthesiology clinical assistant professor. Born in China and educated at MIT, Harvard and Stanford, Dr. Zhang Tikong. Watch and see why acupuncture is used more and more in medicine today.
Hi there. So first of all, thank you for coming here and welcome to our forum. As you can see here, back pain is one of those things that affects all sorts of people, from the young to the old, men and women, and people of all ethnicities. So thank you for coming together for this forum. And before I go further, I'd like to first tell you our game plan today. We'll be talking about acupuncture. Actually, before I start, how many of you have had acupuncture in the past? Impressive. Okay. So we'll kind of breeze through that a bit. I'll tell you a bit more of the Chinese theories behind acupuncture, and also contrast and compare that to Western science. And then we'll analyze if acupuncture would work for low back pain. And then more importantly, we'll talk to you more about what to expect when you choose to use acupuncture. And then finally, we'll conclude. So what is acupuncture? So in Greek, acus means needle, and puncture means to pierce. And acupuncture is an ancient therapeutic technique developed in China about 3,000 years ago or earlier. And so it has garnered much popularity not only in Asia but also in Western countries. As you can see here on the other side of the screen, this is from a paper published in the New England Journal of Medicine, one of the top journals here in America. This particular paper here endorses the benefits of acupuncture and listed a few interesting points which practitioners typically use to treat back pain. So the next question, again, for those who haven't used acupuncture, actually for those who have used, do you think acupuncture hurts? Okay, yeah, it doesn't hurt too much. So, so here's a picture that contrasts the size of our needle to small things. You can see the match here is actually huge. And then a tenth of that is a medical needle, syringe needle. Smaller than that is a small sewing needle, and acupuncture is about a quarter the size of a sewing needle. It punctures through specific points on the body, and you're not really supposed to feel sharp pain from these needles. And most importantly, at least in this country, they're all sterilely prepared and one-time use only. So there should be no concerns for infection and such issues. Okay, so the next part is sort of a condensed ideology on Chinese medicine. So how does acupuncture work according to the Chinese people? There's two very important foundations in Eastern Chinese medicine. The first concept is energy flow and meridians. The idea is that there are invisible channels on top of your body that connects the external part of the body and internal organs. External refers to muscles, skin, and bones, and internal refers to organs, heart, and lungs. So the idea is that you can achieve optimal health when you have regular energy flow, or qi flow in Chinese, in these channels smoothly. There are about 12 meridians in your body, and ideally, the energy should flow very well in all these channels. The second concept is more of a static concept, not dynamic. The second concept refers to balance. So there's all kinds of balance. The most famous one is the yin-yang balance, right? You probably heard of the yin-yang twins and whatnot. So in Chinese ideology, yang refers to the sun, male, energy, and top part of the body. And yin refers to earth, female, resting, and nutrition. So as you can see very nicely here, the other part about interesting about yin yang is that it's all metaphysical. The yin has yang in it, and yang has yin in it. So, I guess in a way, if you make an example, a beautiful woman, she is not just all feminine. There's also, we value strength and assertiveness in a woman. And similarly for men, we like men who are sensitive, or I guess I do. So in any case, so that's the very interesting concept from ancient Chinese mythology and Chinese medicine. So just out of interest, I love this little picture here from the web, white kitty and black kitty. And I want to show you quickly my own yin kitty and yang kitty. This beautiful girl here, her name is Bella. And this very cute boy here, his name is Thunder. They are great pets. So, okay, next. So, acupuncture equipment. What do you typically see in an acupuncturist office? Clearly, the first thing is needles. All sorts of needles. Just give me a second. So besides the needles, is electrostimulator, which I have one right here. So typically, practitioners would connect the needles to the electrostimulator via wires. And a lot of studies, particularly of recent times, both in China and in the Western world, have shown that electroacupuncture seems to have special effects in reducing pain. Third element, which is used in almost every acupuncturist office, is a heat lamp. Typically, these are not just regular heat lamps. These are far infrared heat lamps, which has larger wavelength and can penetrate into deeper tissue, such as the muscle. So these are the sort of the principal component of an acupuncture treatment. There are also adjuncts, appendages. For example, moxa, which is sticks of dry mugworts, the provider would burn the moxa, and they would produce both heat and a warm incense. And secondly, very commonly, you've probably seen that in your acupuncturist office, cupping. So it's very cool. People would put hot air in the cups, and then slap the cup immediately onto patient's skin, ideally along a certain meridian, and then so immediately it will suck up some skin and underneath tissues, and you move the cup up and down, and typically it's very stimulating and tend to relieve a lot of pain from the muscles. All right. So the next thing is now that we know sort of in the Eastern ideology how acupuncture works based on energies and balance and dynamic flow, how does it really work in the Western reductive mind? So this is to echo a lot of points made earlier today from Dr. Mackey and Dr. Darnell when they mentioned that pain is a complex pathway which involves both perception of pain from the periphery and also influence of perception via brain and spinal cord. So acupuncture has been shown by a lot of studies to augment this descending influence of pain perception. Specifically, it produces this happy chemical called endorphins, which is a key ingredient in the downregulating pathway. And acupuncture has been shown to increase endorphins multiple folds in both the brain and spinal cord. So that's one of the best shown mechanisms of acupuncture, particularly relevant to pain, including back pain, headaches, and arthritis. So next, how does it work? So acupuncture also, so when you think of chronic pain, a lot of people think of pathology and chronic inflammation. So inflammation does exist typically with chronic pain, both at a tissue level and at the nerve, at the brain and nerve level and spinal cord level. And there are chemicals involved with inflammation, such as interleukin-1, interleukin-6, which I did not detail here, as well as hormones such as cortisol. Acupuncture has been shown to modulate these levels of both cortisol and these inflammatory soup markers. What do you call that? Inflammatory spice in your body fluid. So to such an extent that acupuncture will reduce inflammation both in the nerves and in the brain and in the periphery where the muscle and nerves are. Okay? So lastly, again, I shouldn't say lastly because there are many other known mechanisms. I'm only quoting you here the most important ones so far, which are relative and relate to chronic back pain. So the last one is acupuncture reduces muscle pain profoundly, particularly stiffness and pain, by working at the neuromuscular junction which is right here, the junction between nerves and muscle fiber. Acupuncture sometimes elicits a twitch response. So when you practitioner needles you feel a little twitch. That's because the needles are very close to these little structures here, and they cause stimulation, which subsequently causes a profound release of pain and relaxation within these muscles. Basically, the idea is that muscle tension and weakness causes pain, and acupuncture reduces the tension significantly. Okay, sorry, I went ahead of myself, did I? Okay, so does acupuncture treat back pain? So based on the mechanisms we talked about, that acupuncture increases happy chemicals or pain-fighting chemicals in the brain and spinal cord, that it reduces inflammation everywhere, and it also reduces muscle stiffness. It is most likely that it will help with chronic back pain. Because why? Because regardless of your cause of back pain, eventually you end up with similar kind of sufferings involving muscle stiffness, involving inflammation everywhere, and involving a general decrease of pain-fighting chemicals. That's why the stuff we talked about, psychological therapies, the physical therapies, they help you boost these happy chemicals, and acupuncture gives you a very profound boost. So in any case, it does help with chronic back pain. In addition to that, multiple large-scale clinical trials involving between hundreds to thousands of patients, both in the West, including particularly Germany, England, and US, and in the East, particularly China and Japan, showed that acupuncture or acupuncture-like interventions causes much better pain relief compared to standard care, which is defined as medications, physical therapy, and physician's visit. Okay. So, however, I think to be completely honest and being responsible as both a researcher, practitioner, and a medical teacher, I want to tell you that acupuncture, chances are, will not eliminate all the pain that you have, particularly if you have nerve pain specifically caused by disc herniation and compression of nerves. And the truth is, however, that I doubt that there's any one single intervention that will eliminate your pain 100%. I think that'll be a false message for me to deliver. I think what we're trying to do here is to tell you that chances are magical pills, bullets, needles don't really exist. Our goal is to reduce your pain to enough extent that will allow you to function and allow you to also be more independent and try other techniques. So first question is, does everybody respond to acupuncture? Of course, I want the answer to be 100%, but the reality is it's about 60%. About 60% of the folks respond to acupuncture, and right now it's still largely uncertain what determines a responder. We know that factors such as your anatomy, your genetics, which you cannot control, and the way you feel about yourself and your body, or which you can control, together interact and influence the outcome of acupuncture. However, there has not been formal studies until about now, because I'm leading a study, as Dr. Darnell mentioned, which is got funded from NIH starting next year, looking at how acupuncture acupuncture will help, how it will help with back pain, and most importantly, what determines a patient's response to acupuncture. We'll send out flyers a little bit later, but just so you know, we welcome any patients with back pain for this particular study. Okay. The next important question as a patient would be, what are the side effects? What are the side effects of acupuncture? So first of all, I want to say it's a very safe intervention. As I mentioned, we use tiny hair-thin needles, which are, you want to see one? Will they break? No, these are made, I hate to say, these are made in Japan and China. They're very nice. These are carbonized stainless steel, so they're soft. They're soft and malleable, hair thin. You can come and take a look a little bit later if you like. Yeah, and they're one time use only. So they're pretty safe. What's the chance that this thing can cause severe damage in you? Extremely minimal. The most common side effects from acupuncture is just minor pain from the site of needle insertion and potentially a small bruise, which typically will typically resolve in about 2 or 3 days. The chance of major side effects is extremely rare. I guess the biggest harm is what you think could be, right? People think of porcupines being stuck and all that. Actually, it's not that bad at all. Most of my patients feel a sense of profound relaxation during the treatment, and for several days after the treatment as well. So, yeah, it's more up here sometimes where the pain and fear comes from. Okay, so what to expect number 2. When should I try acupuncture? So I remember a lot of you guys just had a fabulous talk this morning by our very own Dr. Heather King talking about self-care, which is absolutely great. So I would say you can try acupuncture if self-care by itself cannot take care of all your pain and concerns. You can try acupuncture, which essentially means anytime, okay? And the other question is, can I have acupuncture along with other treatments such as a wonderful physical therapy Corinne just talked about, or psychological interventions that Dr. Darnell and Dr. King mentioned? The answer is not only yes, but an absolute yes, 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 yes. Because there has been several clinical studies that showed acupuncture augments the benefits of physical therapy profoundly. And also, psychological interventions work well with acupuncture. So it's important, if you can, combine them. Next one, medications. Do medications affect response to acupuncture? The answer is yes, in different ways. For example, opioids such as Vicodin and morphine, they can actually interfere with the benefits from acupuncture because they work together, work through the happy chemicals. When you take morphine, there's too much outside happy chemicals for you to really perceive the benefits from acupuncture. So I typically tell my patients to lower their opioid dose, if possible, but not required. And secondly, certain antidepressants, for example, nortriptyline, a tricyclic antidepressant, it actually can double the benefits of acupuncture because they work through different mechanisms. Supplements, most supplements are fine except for caffeine. Some of my friends from Brazil and also from here have shown that caffeine, again, work on the same chemical as acupuncture in the periphery, which is this molecule called adenosine. So adenosine helps pain reduction in the periphery, in the tissues, in the muscle. But caffeine can actually interfere with adenosine metabolism, or the makings and breaking down of adenosine. Hence, if you can moderate your caffeine intake while receiving acupuncture, it'll be very beneficial. Okay. Now, what's next? What's a typical acupuncture session? It's usually about half an hour to 60 minutes long, costing about $50 to $200 in the U.S. Depends on your provider, how much they charge. And most successful clinical studies involving the use of acupuncture in treating pain, particularly back pain, they use between 10 to 15 sessions of acupuncture. So we recommend about 10 to 12 sessions, 1 to twice per week. In China, it's given a lot more frequent, could be even daily, which work too by their studies. But here in this country, what's more common is once or twice per week for a total about 5 to 6 weeks. That's considered a typical course. And if you respond, you should respond by that time. Okay, again, when do I expect pain relief by acupuncture, partial or a little bit or a lot? It really varies. Sometimes I see immediate pain relief by the end of the treatment session. Sometimes it may take a couple days for you to see the benefits. And again, I didn't write down here, but a natural segue for this would be, do all acupuncturists created equal, right? I think it's a very great question. And I think the answer to that is not exactly straightforward. So yes and no. By yes, I say that, again, based on the clinical studies, in several large studies, so they don't see much of a difference in the training of their acupuncturists. However, these are standardized acupuncturists. In Germany, they're usually physician acupuncturists. And in the US study, they are licensed acupuncturists with about 5 years experience or more. However, if you take these acupuncturists and compare and contrast these people, you don't see much difference. So I think the answer is not quite there. We're still trying to figure it out. But I would say it's probably safe to go with either, a licensed acupuncture with good experience or a physician acupuncturist. Yeah, based on previous studies. Okay, very finally, insurance. So who covers acupuncture? This is kind of unfortunate. Compared to Germany and England, or China, we are way behind in taking care of our patients using complementary and alternative medicine. For example, one of the biggest medical insurance in this country, Medicare, does not even recognize acupuncture for any conditions. So that doesn't pay. And second, Medi-Cal is sort of a hit or miss. It doesn't always cover. Sometimes it does. And the problem with Medi-Cal is that it covers in a very meager rate, which I prefer not to do because they only allow the patients to have treatments once per month. There's no study that shows benefits of acupuncture if you receive only once per month. Ideally, it should be at least once per week, okay? And then private insurance, about 50-50 as well. It's important that you check your insurance before you start acupuncture treatments. A lot of practitioners take self-pay. If you do self-pay, there's typically about a large amount of discount. So figure that out. You want to be financially savvy and also take care of yourself in the best way possible. All right. So here we go rapidly to our conclusions. So acupuncture is generally safe and not painful. And it helps with chronic back pain through several mechanisms by A, increasing pain-fighting chemicals in the brain and the spinal cord, B, by reducing inflammation overall in the body tissues and in the spinal cord, and lastly, it reduces myofascial pain by reducing tense, stiff muscles. Realize that it may not take away all of your pain, but it works to take away at least 30% of your pain for a lot of patients, like in 60% of patients. Okay, next, back pain patients should try acupuncture as soon as self-care is not working by itself. You can try acupuncture alone, or even better, combine that with physical therapy and pain psychology. I want to say here, with physical therapy, acupuncture, because it relieves muscle tension, it'll help you perform the physical therapy exercises better prescribed by your therapist. And with psychology, when you have more relaxation and can better concentrate and rest better, you will, I think, be more receptive to different ideas about self-care management. Okay, so that concludes my my prepared talk. I have to say, confess, on my way here, I realized, oh my God, all these great colleagues have wonderful talks. They make you meditate and move your backs and everything. I figured I may also demonstrate something. So what I want to show you here is a bit of acupressure. So we're going to show you two different points, okay? The first point is that nausea and relaxation point. So when you have pain, sometimes when it becomes severe, you may feel a bit nauseous or anxious. So one of the most classic points in Chinese medicine is this thing called the inner gate. So come here, find your wrist. There's a crease in your wrist, right? And you go down the wrist crease by two thumb widths, 1 and 2. And you come right into the center. And if you press on that, typically you will feel a very nice deep ache. And you can actually do self-massage on these points. I had some great stories from a great friend of mine who suffered from transverse myelitis, and he was here at Stanford Hospital. At some point, he was hiccuping so much he couldn't stop. They tried all the medications, so eventually they got a nurse. They got I think an emergency nurse. So all she did was this. And that stopped his hiccuping. And also for nausea, seasickness, anxiety, this is a great point. You can do both sides, okay? And the way to do acupressure is first you have to apply a nice steady pressure to the extent that you feel deep ache. Once you feel the ache, you can do a little bit regular circular motions. And do that for about 2-3 minutes, okay? And try the other side. Now, the second point I want to show you is also a very cool point. It's called, so this one, remember, it's called the inner gate. The gate to your inner self, inner gate, okay? The other point is right here. It's called the posterior creak. The idea is sort of on the posterior side of your hand. If you make a fist, you can see there's a little protrusion right here on the side, just under the big joint of your small finger, right? You can feel a little bit of protrusion right here. And if you press that real hard, this is one of the better classical points in Chinese medicine that treats back and neck pain. So actually, my mom sent me a little video not too long ago. She said you can just put your hand on the desk like this and rub it back and forth. So, and that's a little way to release your back and neck pain. So you can try that in your spare time. And so yeah, that's exactly.